Hey everyone, and welcome to another Deep Dive. Looks like we've got some intense medical info to unpack today, all about circulatory shock.
That's right.
Yeah, we're going to try to break down all this complex stuff,
It's a good one.
from the types of shock and how it's diagnosed, to the treatments.
Absolutely.
And there's actually a type of shock where your skin feels warm,
Oh, yeah.
not cold.
Yeah, we'll get to that.
Yeah, we'll get to that.
Yeah,
But first, can
definitely.
we start with just what circulatory shock actually is at its core?
Yeah, so basically, circulatory shock is this critical mismatch
Okay.
where your body's tissues aren't getting enough oxygen,
Okay.
even though there's plenty of oxygen in your blood.
Huh. So it's like a delivery system gone wrong.
Exactly. It's like a traffic jam in your circulatory system.
Oh, okay.
And this isn't just feeling faint or lightheaded,
Right.
this is life-threatening.
Oh, wow.
This requires immediate medical attention.
So what causes these traffic jams to happen in the first place?
Well, there are four main things that can go wrong. First, you have hypovolemia.
Hypovolemia.
Hypovolemia, that's where you lose a lot of blood or fluid.
Oh, so if you have a major bleeding,
Exactly.
like a really bad injury or burn.
Yeah. Major bleeding, severe burns, even extreme dehydration.
So in that case, there just isn't enough blood to go around to carry oxygen.
Exactly.
Makes sense. Okay, so that's one cause. What are the others?
So then you've got what's called myocardial dysfunction.
Okay.
And this is where your heart itself isn't pumping effectively.
Oh, so it's like the pump itself is weak.
Yeah, think of a pump struggling to push water through a hose.
Gotcha.
That's what happens when the heart muscle is weakened.
So the engine itself is sputtering.
Uh-huh.
What else can go wrong?
You can also have what's called obstructed blood flow.
Okay.
So that's where something is physically blocking the blood vessels,
Okay.
like a pulmonary embolism.
Oh, what?
Pulmonary embolism. That's where a blood clot gets lodged in an artery in the lung,
Oh, wow.
or a tension pneumothorax.
Tension pneumothorax.
Yeah, which is basically a collapsed lung putting pressure on the heart and major vessels.
So it's like a literal roadblock in the circulatory system.
Exactly.
Wow. Okay. So we've got hypovolemia, we've got myocardial dysfunction, we've got obstructed blood flow.
Mm-hmm.
What's the fourth one?
The fourth one is distributive issues.
Okay.
So this is where the blood vessels dilate too much,
Okay.
like in allergic reactions or sepsis. Yeah, where inflammation causes those blood vessels to widen way too much.
So the pikes are too wide.
Exactly.
The pressure just drops.
Yeah, and it leads to a dangerous drop in blood pressure.
Oh, wow. That's scary.
Yeah,
It's amazing how many things can go wrong with this delicate system.
it is.
But our bodies don't just give up when something like that happens.
No, they don't. Our bodies are amazing.
Yeah.
They have these compensatory mechanisms.
Compensatory mechanisms.
Yeah, to try to counteract the problem.
So it's like the body's own defense system.
Exactly. It's like survival mode.
So what kind of things does the body do?
Well, it tries to increase the heart rate.
Okay. To pump blood faster.
Yep. And constrict blood vessels to maintain blood pressure
Mm-hmm.
and hold on to fluids to try to boost the blood volume.
So it's really pulling out all the stops.
It really is.
But are these emergency measures always a good thing?
Well,
Because it sounds like it could kind of backfire.
it can, yeah. So they buy you time, but if you don't address the root cause quickly,
Right.
it can backfire.
Mm.
So, for example, that vasoconstriction.
Constriction.
Yeah, the constricting of the blood vessels. That can actually start to restrict blood flow to the vital organs.
Oh, so it's trying to help, but it could actually be hurting at the same time.
Exact.
So
Oh,
it's
yeah.
really important to get help quickly.
Absolutely.
Okay, so we've talked about some of the things that cause circulatory shock,
Right.
and we've talked about how the body tries to compensate.
Mm-hmm.
But I know there are different types of circulatory shock.
Yeah.
Can you break down the main categories for us?
Yeah, so broadly speaking, we can put them into two categories: quantitative shock and distributive shock.
Okay, so quantitative versus distributive.
Yeah, so quantitative shock is all about having a reduction in blood volume.
So not enough blood.
Yeah, like not enough fuel in the tank.
Gotcha.
And then distributive shock is about the blood being in the wrong place at the wrong time.
Interesting.
So it's like having a fuel leak or blockage in the delivery system.
That makes a lot of sense.
Yeah.
So let's start with quantitative shock.
Okay.
What would be an example of that?
So the classic example is hypovolemic shock,
Right.
which we already talked about a little bit.
Yeah, from blood loss or fluid loss.
Exactly. So severe loss of blood or fluids
Uh-huh.
leads to a drop in blood volume,
Okay.
and that decreases oxygen delivery.
So the car's completely out of gas.
Exactly.
Can't go anywhere.
Yeah.
All right, what else falls under quantitative shock?
So the other one is cardiogenic shock.
Okay.
And this is where the problem is with the heart itself. The heart muscle isn't strong enough to pump the blood effectively.
So the engine's failing,
Yeah,
even though there's plenty of gas in the tank.
a perfect analogy.
Right, so that's quantitative shock. And then distributive shock is where the issue isn't the amount of blood, but how it's moving around the body.
Right.
So that would include things like septic shock and anaphylactic shock.
Exactly.
Right.
Yeah.
Okay, let's talk about those. What is septic shock?
So septic shock is a serious complication of sepsis.
Right.
Sepsis is your body's overwhelming response to an infection.
Uh-huh.
And so in septic shock, that inflammation causes your blood vessels to dilate.
Oh, okay.
And your blood pressure drops dangerously low.
So it's like the body's own defenses are working against it.
Exactly.
Wow. Okay. And then what about anaphylactic shock?
So anaphylactic shock is a very rapid allergic reaction.
Okay.
It's triggered by exposure to an allergen, something you're allergic to.
Like food or a bee sting or something like that.
Exactly. It could be food, medication, insect venom.
And then your body just freaks out.
Well, the immune system overreacts,
Right.
releases a flood of chemicals,
Okay.
and that causes your blood vessels to widen super fast,
Okay.
and that causes a sudden severe drop in blood pressure.
So that's why people carry EpiPens, right?
Yes,
So
exactly.
those kinds of reactions.
Epinephrine is key in treating anaphylactic shock.
So before we talk about treatment, how do you actually diagnose circulatory shock?
It's a bit like detective work, right?
Okay.
You're looking for clues.
What are some of the clues?
So first we look at heart rate,
Okay.
tachycardia, so rapid heart rate. That's common.
Right. The body's trying to compensate,
Exactly.
but sometimes it's the opposite.
Sometimes you see bradycardia.
Bradycardia.
Yeah, which is a slow heart rate.
Huh. So either way, an abnormal heart rate is a bad sign.
Yeah, especially coupled with other symptoms.
Okay. So what other things are you looking for?
Well, low blood pressure, of course.
Right.
It might not be super low in the early stages because the body's trying to compensate, right?
Right.
So even a slight drop could be a sign of trouble.
So you're looking for trends more than one specific reading.
Right,
Yeah.
exactly.
Okay. What about the pulse?
So weak pulses, especially in the extremities like the wrists and feet,
Okay.
that's another indicator that the blood flow isn't good.
Makes sense.
And then there's capillary refill time.
Okay. What is that?
That's how long it takes for the color to return to the skin after you press on it.
Oh, okay.
So if it's delayed, it means the blood's not circulating well.
So like if you press on someone's finger and it stays white for a long time,
Yeah, that could be a bad sign.
especially with other symptoms.
Exactly.
Okay. What else?
You might see cold or mottled skin.
Mottled.
Yeah, it'll have a blotchy or purplish appearance because the blood flow is bad.
Oh, like when your fingers get really cold in the winter?
Kind of like that.
But this is more serious, obviously.
Yeah, much more serious.
Yeah.
And then there's altered mental state.
Oh, like confusion?
Yeah, confusion, anxiety, even lethargy, unresponsiveness,
Okay, so any change in behavior could be a sign.
especially with other symptoms.
Right.
And then finally, decreased urine output.
Oh? Okay.
That means the body's trying to conserve fluid
Okay.
and the blood flow to the kidneys is compromised.
Wow. It's amazing how the body tries to protect itself,
It really is.
even in such a serious situation.
Yeah,
But it's clear that getting help quickly is crucial.
absolutely.
So what happens when someone gets to the hospital? How do you actually treat circulatory shock?
So the treatment, it's like a two-pronged attack.
Okay, a two-pronged attack.
You gotta tackle the problem from both ends.
Okay, I like that. What's the first prong?
So the first one is what we call symptomatic treatment.
Symptomatic treatment.
Yeah, this is all about immediate life support.
So like stabilizing the patient.
Exactly, you're buying them time.
What does that involve?
So first you got to make sure they've got enough oxygen.
Right, breathing is the most important thing.
Exactly. Might need supplemental oxygen, maybe even a ventilator.
Okay, what else?
Then you've got fluid resuscitation.
Fluid resuscitation, that's a fancy way of saying IV fluid.
Exactly. So we give them fluids intravenously
Okay.
to increase the blood volume and blood pressure.
Right, to replenish what's been lost.
Exactly. But it's not as simple as just pouring fluids in.
Right, because too much fluid could be bad too.
Exactly. Too much can overload the heart.
Especially if it's already weak.
Exactly.
So it's a balancing act.
It is.
And then you said there was a second prong.
Right. The second prong is what we call etiological treatment.
Etiological treatment. Okay.
And this is where you focus on addressing the actual root cause.
So like stopping the bleeding.
Exactly, or giving antibiotics to fight an infection.
Or epinephrine for an allergic reaction.
Exactly.
So it's all about figuring out the root of the problem
Yeah,
and then giving the right treatment.
exactly.
Wow, this is all really fascinating stuff.
It is.
Before we move on and talk about each type of shock specifically,
Okay.
what's one thing that you find really interesting about all this.
I think it's just amazing how, even in a crisis, the body just keeps working to stay balanced.
That's true.
It's a testament to how resilient our bodies are.
Yeah, it's a reminder to appreciate our bodies
Absolutely.
and what they do for us.
Yeah.
Okay, well, we've covered a lot of ground today. We've learned about the causes and types of shock,
Uh-huh.
and we've even touched on how the body tries to compensate
Right.
and a bit about how it's treated.
Yeah.
But we're just getting started. So when we come back, we'll talk more about how to treat each specific type of shock.
Okay.
And maybe we'll even get into some of the latest research.
Sounds good.
So stay tuned.
All right.
Make sure you follow us on all social media platforms to stay updated. We hope you feel empowered to learn more. Stay curious, stay informed, and most importantly, stay well.
All right, so we've got a good foundation for understanding circulatory shock now.
Yeah.
But now let's roll up our sleeves and really get into each specific type.
Okay.
And let's start with hypovolemic shock.
All right.
So this is the one where it's all about volume,
Exactly. Or the lack of it.
the lack of it, right?
You know, it's like trying to run a marathon on an empty stomach.
Ooh, that's a good analogy.
You just don't have the resources you need to keep going.
Yeah, so we're talking about major bleeding, burns, dehydration,
Right.
where the body loses a ton of fluid.
Mm-hmm.
So what's the first priority in treating this type of shock?
Well, you got to stop the loss.
Okay, yeah, that makes
It's like
sense.
plugging a hole in a sinking ship.
Right, you got to stop the leak before you can refill it.
Exactly. Whether it's bleeding, burns, dehydration,
Yeah.
the first thing you got to do is stop it from getting worse.
So control the bleeding, manage the burns, rehydrate the patient.
Exactly.
Okay, so once you stop the leak, what's next?
Well, then you got to refill the tank.
Right,
We call it fluid resuscitation.
fluid resuscitation.
Yeah, basically giving them IV fluids
Right.
through an IV drip.
Which is so common in the ER.
Oh, yeah, it's a staple of emergency medicine.
We use crystalline solutions like saline
Yeah.
to restore that blood volume.
Exactly, and get the blood pressure up. Okay, but I imagine it's not as simple as just like pumping fluids in.
No, you're right.
There's got to be a balance.
Absolutely too little fluid,
Yeah.
and you're not going to get enough blood flow.
Okay.
Too much,
Yeah.
and you risk overloading the heart.
Especially if it's already weak.
Exactly.
So it's like finding that Goldilocks zone, not too much, not too little.
Exactly. You want just the right amount to get the optimal pressure.
All right, so that's hypovolemic shock. Let's talk about cardiogenic shock.
Okay.
Now, this one seems trickier
It is.
because the problem isn't the fluid,
Yeah, this time the problem is the heart
the
itself.
heart itself.
So it's like having a car with a sputtering engine.
Oh, I like that analogy.
You can put as much gas in it as you want, but if the engine's not working, it's not going to run.
It's not going anywhere.
No.
So how do you fix a sputtering heart? What's the treatment for cardiogenic shock?
Well, just like any engine problem, first you got to make sure it's got enough fuel.
Okay, and in this case, the fuel is oxygen.
Exactly. So supplemental oxygen is key.
Okay, and sometimes even mechanical ventilation if they can't breathe on their own.
So first, make sure the heart has the oxygen it needs to function.
Right.
All right, what else?
So medications play a big role here.
Okay.
We use inotropes to strengthen the heart's contractions.
Inotropes.
Yeah, think of it like giving the engine a tune-up.
Okay.
And then we also use vasopressors to help constrict the blood vessels and raise that blood pressure.
So it's kind of two sides of the same coin.
Yeah.
You're supporting the heart function and also making sure that blood pressure stays up.
Right, so that those vital organs are getting the oxygen they need.
Okay, so you've got meds to help the heart.
Mm-hmm.
Are there any other things that can be done for cardiogenic shock?
Yeah, sometimes we need to go beyond just medication.
Okay.
You know, like a balloon pump to assist the heart's pumping action,
Wow.
or even surgery to repair damaged valves or arteries.
So sometimes it's a multi-pronged approach
Absolutely.
to get that heart back on track.
It takes a whole team.
Wow, that's incredible. Okay, so we've talked about hypovolemic and cardiogenic shock.
Right,
Let's move on to distributive shock.
right,
Now, these are the ones where the problem isn't the heart itself or the
No.
amount of blood,
right.
it's how the blood is distributed.
Exactly.
So that would include things like septic shock and anaphylactic shock.
Uh-huh.
And we talked about septic shock a bit earlier. You said it's a
Right.
pretty big deal, right?
Well, yeah, septic shock is a huge problem.
Okay.
It's a leading cause of death in ICUs around the world.
Wow.
And it's getting even harder to treat because of antibiotic resistance.
Right, because the bacteria are becoming resistant to the antibiotics.
Exactly.
Okay, so what's the strategy when someone comes in with septic shock?
Well, the first hour is critical.
Okay.
You got to act fast.
What do you do?
So the first line of defense is broad-spectrum antibiotics.
Broad spectrum, so they target a wide range of bacteria.
Exactly. It covers all your bases while you're waiting for the blood cultures.
Right, to tell you exactly what bacteria you're dealing with.
Uh-huh.
So it's like a preemptive strike while you figure out who the enemy is.
Exactly.
Okay, so you've got the antibiotics going.
Yeah.
What else do you need to do for septic shock?
So along with the antibiotics, you also have to focus on that fluid balance
Right.
and supporting that blood pressure.
Okay.
So just like with hypovolemic shock, fluid resuscitation is super important.
Okay.
And we often need vasopressors.
The meds that help raise blood pressure.
Exactly.
So you're fighting the infection with the antibiotics, and then you're also supporting the body's systems with fluids and meds.
Yeah, it's a multi-pronged attack.
I like that.
You're putting out the fire,
Right.
but you also got to make sure the building doesn't collapse.
Right. You're supporting the whole structure.
Exactly.
Wow. That's a lot to think about.
It is.
Okay, now what about anaphylactic shock?
All right, so this is that rapid onset allergic reaction.
But it comes on super fast.
Yet you're exposed to an allergen and your body just overreacts.
Yeah.
So it releases all these chemicals, causes widespread vasodilation.
Right. The blood vessels widen way too much.
And your blood pressure just plummets.
And that's why it's so important to act fast.
Absolutely. Time is of the essence.
So what's the first thing you do when someone's having an anaphylactic reaction?
Epinephrine.
Epinephrine, that's what's in the EpiPen, right?
Exactly.
So it's like hitting the reset button on that immune system overreaction.
Exactly. It works so fast
All
to
right.
counteract those effects.
And how does it actually work?
It constricts the blood vessels,
Okay.
opens up the airways, helps stabilize the heart rhythm.
So it's really saving the day.
It is.
Okay, so epinephrine is the first line of defense.
Right.
What else might you do for anaphylaxis?
So sometimes we also use antihistamines
Okay.
and corticosteroids to further reduce that allergic response.
So it's like epinephrine to stop the immediate problem, and then these other meds to calm things down
That's right.
and prevent further complications. Wow. We've learned so much about treating all the different types of shock.
We have.
Before we move on to the latest research in this area,
Okay.
is there anything that really stood out to you about all this information on treatment?
It really just blows my mind how the body responds to a crisis.
I know, it's incredible.
You know those compensatory mechanisms? They can be a double-edged sword, but they're proof of how resilient the human body really is.
Yeah, it's always trying to find a balance.
Exactly.
It's always trying to keep us alive.
It is.
All right, well, on that note, I think we need to take a quick break.
Okay.
We've delved deep into the world of treating these different types of circulatory shock. And now we're ready to explore the cutting edge of research.
Sounds good.
So stay with us. And we're back, ready to explore the future of circulatory shock treatment and research.
Yeah, it's a really exciting time to be in this field.
I bet. So much is happening, new tools, new therapies.
Absolutely.
What are some of the things you're most excited about?
Well, one area that's really interesting is personalized medicine.
Personalized medicine. Okay.
So researchers are working on identifying these biomarkers.
Biomarkers.
Yeah, you can think of them like molecular fingerprints.
Okay.
That can tell us which patients are most at risk for shock
Okay.
and even which treatments will work best for them.
So it's like tailoring the treatment to each individual patient.
Exactly.
Yeah.
It's all about moving away from that one-size-fits-all approach.
Right, because everyone's body is different
Exactly.
and responds to treatments differently.
Uh-huh.
That's amazing. So what else is happening in the research world? What else has got you excited?
Well, another area that's really cool is immunomodulation.
What?
Immunomodulation.
Okay.
Especially for septic shock.
Right.
Remember how we talked about the body's immune response sometimes going overboard?
Yeah, it's like it attacks healthy tissue along with the infection.
Exactly. So researchers are trying to figure out how to fine-tune that immune response.
Yeah.
So you dampen the inflammation, but you don't stop the body from fighting the infection altogether.
So it's like teaching the immune system to be more precise.
Yeah, like a more controlled warrior.
I love that analogy.
Yeah.
Okay, what about fluid resuscitation? Any cool new things happening there?
Definitely. A lot of research is going on there, too.
Okay.
Looking at different types of fluids, different ways to administer them, trying to find that perfect balance.
Right, to restore the volume without overloading the heart.
Exactly.
So it's like you're trying to create the perfect recipe.
Yeah, the perfect IV cocktail.
I like that.
And of course, there's the research into vasopressors.
The meds that help with blood pressure.
Exactly.
Trying to find ones that are more effective and have fewer side effects.
Always trying to improve.
It's incredible to think about all the work that's being done to understand and treat this condition.
It is.
You know, it gives me hope for the future.
Me too.
So before we wrap up, what's the one thing you want our listeners to take away from all this?
I think the most important thing is that knowledge is power.
I agree.
The more you know about circulatory shock, the better prepared you are to recognize it and get help.
Right, because early intervention can literally save lives.
Absolutely.
Well said. Well, I think that brings us to the end of our deep dive into circulatory shock.
Wow.
We've gone from the basics to the cutting edge of research.
We have.
And I hope everyone listening has learned a lot.
Me too. It's been a great discussion.
It has. And to everyone listening, thank you for joining us on this deep dive.
Yeah, thanks for listening.
We hope you've gained some valuable insights into this complex condition.
And that you feel empowered to learn more.
Exactly. Stay curious, stay informed, and most importantly, stay well.
Make sure you follow us on all social media platforms to stay updated. We hope you feel empowered to learn more. Stay curious, stay informed, and most importantly, stay well.